On November 26th of 2010, my daughter passed out for the first time. This was also 2 days after her first birthday, as well as 2 days after she had been vaccinated for her 12-month vaccines. She does suffer from what is called breath-holding disorder and is common in kids, and they will usually grow out of it. But cyanotic form is the form that is the most common in kids, where she actually has two forms. She has cyanotic and pallid breath holding. The cyanotic is usually due to anger, frustration. They will usually quit breathing for up to a minute. They become limp. They often become like a bluish white color, sometimes purple around the mouth. They begin breathing on their own normally. The pallid form is actually when the heart rate drops and they become a rigid, have almost like a seizure activity, can lose their continence. This is also usually a response to pain. A lot of times when the pallid form happens, you don't even hear her cry at all. All of a sudden, she's down. This is something that we have visited Children's Hospital in Dayton about. We saw a neurologist. All of her tests came back normal, except it is linked to an iron deficiency. She does have iron deficiency anemia, and her pathology labs have come back on a regular basis as abnormal red blood cell shape. Her cells are actually not formed large enough to be able to bind enough oxygen to the red blood cells to carry throughout her body. So when her iron is extremely low, we will see more passing out episodes. And this is not just something that happens maybe once a month, once every 6 months. Sometimes this happens 5 times a day, once a day, 3 times a week. It just all depends. Right now we are in the process of trying to figure out if this is something that was due to vaccination, if this is just something that is her and she's going to outgrow like they tell us she should. At the age of 4, she should be close to outgrowing it, but for her, this is not something that has even become slowing down. We have not seen any slowing down with this. She continues to do this on a regular basis, so our next step is meeting with a team at Children's Hospital in Columbus just to make sure we aren't missing anything anywhere. So if you happen to see us out and about and my daughter throws a temper tantrum and passes out, she'll start breathing again. This is, at this point, a normal thing.